Thank you, Mr. Chairman. We've had so many discussions like this, and I wish I had a big something to hold up, but I want to just talk about this. It has nothing to do with pharma. It has everything to do with a system that's broken with no transparency, no competition, barriers to entry, and by the way, a consumer who doesn't have the tools to really measure what the best value is. This is a case in California that impacted a sophisticated self-insured plan, and it had a psychiatric underpinning to it. But how that could ever end up being $4 million, that's what the company paid for that case. A self-insured company that's going to be a lot more sophisticated than any individual would be. Cigna, the insurance company, got $2.5 million of what the company paid. Another multi-plan TPA got about $700,000. The provider that actually provided the service, in other words, to affect the cure or the remedy, got $875,000. They are suing the insurance company because they think they didn't get paid enough. And who got screwed was the company and the patient when it was a $4 million claim, and the provider that provided all the services charged only $875, and they made a profit. So that means the claim was probably 10 times the amount of the underlying cost of the service. That's one side of healthcare. Hospitals used to be about 1/3 of the healthcare dollar. Practitioners, nurses and doctors, maybe independent pharmacists, throw them in there at about 1/3. And then pharma and insurance splitting the other third. So the whole thing has gotten convoluted. And then we're talking today about your industry. And I come from the world of distribution. And in any other industry, there's full transparency competition. The consumer drives the dynamic. That's why you don't get by with all the stuff we're talking about. Your business is largely one of heavy fixed costs. Is that correct?
Yes, that's correct. And research.
Yes, which that'd be part of it, research, anything. What are your variable costs generally on a drug like this?
So the raw,
as a percentage of your whatever you're selling it for?
That's perhaps 20%.
So it's very low. Are you making a profit on your Ozempic product when you're selling it to Australia for $87 and you're selling it to the US for $936? Are you making a profit at $87?
Yes, we are. And the price you mentioned in the US is not what we get. That's the list price.
So what are you getting in the US? What price?
So I mentioned that on average for our products, we give 74% in rebates to PBMs. And
that was a chart that Senator Marshall
Yes.
held up, that PBMs are making 74% and you're getting 26.
Yeah.
So you've got a screwed up industry. Number one, when I've talked to other pharma folks, they regret that PBMs ever came into it. It would seem like, since you make the product, that you could disassemble them or do something that would go around it if in fact this place won't do something about it. Have you ever thought of that?
It's very difficult, Senator, because they control what insurance is put in front of patients. So they have integrated themselves with the insurance companies, and we negotiate against the PBMs, but they're owned by the insurance companies. So no matter what we do, they decide what products patients
Okay,
get.
and I think that's kind of the conundrum. But you're making a profit at $87, and of the $936, it would be the list price. Is that total being split between you and the PBM? I know you give big discounts to the PBM. Why do you give them such large discounts for them to make that much money?
Unless we have a high list price and give them rebates, we are not making it onto the insurance formulary. So they make a fee based on the list price. So you mentioned distribution. They don't get a flat fee for the distribution.
So after you give the discounts and you do everything, what is your revenue on Ozempic, roughly?
So I don't have that number from the top of my head. So on average,
that'd be something I think it ought to be on the top of your head, because most of us would want to see that so you can make the case against PBMs. And that basic lack of transparency that to me comes from the top, that cloaks the system in general, is what is impacting the future of why in our own country it's 18% of our GDP, and from Canada to Europe it's 10 to 12% of our GDP. Eastern Europe is 6 to 7%. And yes, rationing is maybe going to be one of the results, but it should never be to where something's going to cost that much more here versus there when you're making a profit on it. And until you figure that out, everyone's going to think your industry's screwed up.
So I'm not sure if it was a question, but I just want to say that since we launched a product like Ozempic in 2018, the price we get has gone down by 40%. So there's a...
And that's good, and it looks like Lilly has got something similar,
Yes.
And they sense competition, and theirs is gone down by 40 to 50%, and that's what we need more of. And until you put it out there, expose the PBMs in terms of what they're getting, and you get consumers engaged in it, you're not going to solve the problem. You're going to end up having government as your business partner, because when you operate like an unregulated utility, you're going to get government regulating you. And I think there's a strong interest in that happening. And unless you, hospitals, insurance, take the bull by the horns, you're going to increasingly be in more conversations like this. And I want to end on this. So why should the Europeans and everyone else be taking advantage of the fact that we do the R&D? Why don't you charge them more to where there's at least not a 10-to-1 differential, to where you share the costs across the world, not put it on the burden of a place that's now borrowing 30 cents on every dollar for whatever's provided through government, and to where you're jabbing it through the private insurance side. Why is there that kind of difference? Why don't you charge them more in Europe?
So, Senator, we might also do that in the future, but actually the price differential you mentioned is not the real price differential. I think that's part of the problem, that we are not charging as much in the U.S. as you...
I think you're hiding behind your opaqueness, and you need to promote transparency for your own good. It'd be easier to understand. Thank you, Mr. Chairman.